Since January 18th, more than 40 persons were screened for the coronavirus. Of that number, 33 were Chinese nationals. This was revealed by the Chief Medical Officer, Dr. Shamdeo Persaud, on Wednesday. Dr. Persaud assured that most of them did not present any high risk of the virus, but 4 persons reported not feeling well. However, according to Dr. Persaud, these persons did not have any signs or symptoms of the virus. He said that doctors from the Georgetown and Linden hospitals visited those 4 persons at home and cleared them of any signs of the virus.
We continue to monitor all arrivals from China, and for persons who have traveled from other countries through China. Once travel involved China, we first of all flag them by immigration authorities as they arrive in Guyana at any one of the ports at this point in time. A screening is done with each arriving passenger, and once we screen them, we check their temperature, take some history on signs and symptoms and then we classify them. So far, we have had more than 40 persons screened, and of those, none of them actually presented with any symptom or a high risk to be isolated.
Prior to January 18th, a total of 17 persons had arrived in Guyana from China, and Dr. Persaud said the Health Ministry was able to track down most of them, with the exception of a European national who traveled through China.
We started screening from the 18th, so I'm reporting as from the 18th. The ones who arrived before the 17th, we were able to track most of them. We lost one person to follow up. We weren't able to make contact with that person, but when we further checked, it was a non-national, a European. We even had an American who traveled, through another route and passed through China and came. And we had a Ukrainian also. So there are various countries that people can come from. It's not only Chinese. We've also had some of our Guyanese students and Guyanese visitors to China too. So we're looking at them all together.
While everyone who was screened did not show any signs of the virus, they were still placed under home isolation for 14 days. Should a serious case arrive in the country, Dr. Persaud said the country has the capacity to handle the virus and have set up an isolation unit at the Georgetown Public Hospital, the Diamond Diagnostic Center, and notified private hospitals to do the same.
So far, we have at least 2 areas prepared. We have Georgetown Hospital have a 14-bed unit, male and female, 7 male, 7 female, that is on standby. All the staff are prepared. We have all the equipment that is needed. And since, as most of you know, there is no specific antiviral treatment for coronavirus, supportive care is what is needed. At this point in time, we have all the essential medicines that are necessary for treating them.
Dr. Persaud said health authorities are working closely with companies and airlines and will continue to monitor all arrivals from China. BBC reported that the virus causes severe lung disease. The coronavirus had infected 70,620 persons in China, and as of February 16th, 1,770 of them died. Reporting for Newsroom, Isanella Patoir.